Hello and welcome to an extremely extravagant episode of Michael and Mom Talk Cancer. I'm your official host, Michael Kramer, and
this is Michael's mom, Ashley. We never know what Michael's gonna say. Okay, today it's extravagant. I love that.
yes, it is.
It's not only extravagant, it's exciting because we've actually never met Jeff. He reached out to me. His name is Jeff Boothman. He wrote a book, and we're gonna get to that book later because it's amazing. But first, we just want to say, oh my gosh, thank you so much for being here. You are amazing. All the advocacy you're doing, all the help you're doing for cancer patients, for survivors, for caregivers, and drum roll. Jeff Boothman. We're so happy to have you.
Yeah, that's quite a build-up. I don't know if I'm going to be able to live up to that billing, but
Yes, you are.
We'll give it a whirl. But thanks for the introduction, and absolutely thanks for having me on board your podcast. It's great. It's great to be here, and I appreciate the opportunity to work with you guys to help people just right alongside you. So thank you.
Of course.
Thank you. Okay, we know some stuff about you, but share.
Well, specifically, I want to ask, like, where did this whole thing start? Because you're a cancer survivor, so I like asking people when they come on and they're cancer survivors, like, what were their early symptoms and how they found out? Because to me, that was one of, like, the craziest things, was finding out I had cancer after not thinking I had cancer.
Yeah.
You know, just, like, going through these weird symptoms for a few months. It was shocking.
And age, okay, Michael was diagnosed at 19.
Yeah.
My husband was diagnosed at 59. I don't know how old were you, all of that
I was
stuff.
48.
Okay. So young. Like, to me, that's young.
Well, I don't know. You ask a younger person, it's old, so.
No, 48 is young. I will tell you that right now. Right, Michael?
Younger than me.
Younger than him. Come on.
I'm with you. So, my story, I had a tumor kind of right above my hamstring on the back of one of my legs, and it never really bothered me, but it was growing, and we just moved to a new house, and we're going through all the stress of finishing building it and all this kind of stuff, and I'm like, I probably should go get this checked out. So I went to my general practitioner, and he's like, I don't know what this is, but I can't really do much with it. So he pushed me into the James Cancer Center here in Columbus. And at the time, they weren't quite sure what it was. So I went in for something they call a needle aspiration, where they basically stick some of stick the tumor and try and figure out what it is. And that was inconclusive. My wife almost passed out during that procedure, so that was...
Was she with you during it?
Yeah, she was, right? And she's not really good with that stuff, so...
oh, goodness.
Yeah, I almost had two patients there for a minute, but she... so that's good.
Funny.
And then, so then they referred me to a surgeon, and the plan was they were going to go and biopsy the tumor and then decide if it was cancerous, how to, resect it, whether there were going to be aggressive or not aggressive in terms of pulling the tumor out, right? So went through that first surgery, and the pathology couldn't quite figure out what it was. And I'm like, oh,
wow.
So
wait, how long ago was this?
Well, it was 7 years ago.
Okay.
Yeah. And so I went back to my surgeon, and he said something to me, and I'm like, I knew I was in trouble at that point, but I didn't know I was officially in trouble. He said, because I'm like, okay, let's, as soon as you guys are done figuring this thing out, I'm ready to go. Let's get this thing out and get on with my life. Well,
right.
He's like, well, we may not take the tumor out. We may let the medicine take care of it. And I'm like, look, I'm a lot of things, but I'm not that dumb. I knew exactly what he was talking about.
Right.
But they didn't know at the time either. So they go back for another surgery. They get the tumor out. And, were aggressive because at that point they knew it was something they didn't want to mess around with. But they still...
Were they saying oncology or cancer or anything?
Yeah.
Oh, yeah, no, I was in the cancer hospital.
You were in the cancer hospital,
Yeah,
okay.
so they, they knew, but they didn't really know exactly, right, what it was. And then I had that, and then when they referred me to the hematology oncology group, I knew I was in big trouble. So...
Right.
and then I went to go see him right after the surgery, my second doctor, and he's like, "Well, you have T-cell lymphoma." And I said, "Oh,
Yeah, we can relate to T-cell lymphoma.
you're right. Yeah, you guys have been through a
It's
lot
a
of this.
different one, but
Same things,
Yeah.
yeah. So yeah, I started chemo. That was the day before Thanksgiving, and I started probably the week after Thanksgiving. So
okay.
yeah, and then that was so my chemo was 4 days inpatient each time.
Right.
On the stick the whole time. I had a PICC line, and so yeah, so I did that for 3 rounds, and then had radiation on the spot where the tumor was taken out. Yep.
Okay. And you
So
had to do a
that's
lot
a-
of radiation, I read.
So there's some similarities here. I did 3 rounds of chemotherapy as well. It was like
Yep.
a 5-6 day admission for me. Did
Right.
radiation.
Yep.
But you didn't have a bone marrow transplant, did you?
No, because it's a different.
Yeah. No, thank you.
Right.
Yeah, that's,
Yeah,
that's an adventure, I bet, right? Yeah.
Oh,
So
yeah, it's an adventure. It's something.
yeah.
But still,
So-
so how you did? I think I wrote it down. But how many? You did a lot of radiation.
15.
15. Okay.
Yeah.
We did
15
It was short.
sessions?
Oh.
15
Yeah.
days?
15 sessions, yeah. So I'd
Like
go every day
Michael.
for 3
Yeah,
weeks.
12 sessions.
So
So
12.
so
Okay.
your treatment
similar.
was like around 4 months long, you would say, with that?
Yeah, right. Yeah, just about exact. Yep. Yeah, because they didn't push me into radiation right away.
Right.
They give you a little bit of time to recover, and I was
Yeah.
Yeah.
I'm
Or-
sure you were. I can't imagine with a bone marrow transplant, but I had.
They don't want you to recover. They
yeah,
want to push you while you're
yeah,
down.
yeah, of course, right? I mean, this is
Yeah.
when you explain to people what they're doing exactly with chemo, you're like, ugh. It's really barbaric, right? If you
Well, they're
think,
trying to kill you, but not you.
right, they
They're
push you
trying to
as
kill
much
your.
as they can, right?
Yeah.
Yeah,
They're trying to save you, Michael.
They're trying
Yeah.
to kill the thing inside of you, but
Yeah.
not you.
yeah,
Yeah.
It is hard with
exactly.
blood cancer because it's everywhere, right? As you know, so
Right. Right. It's
It's
hard.
yeah, it was just crazy, and I had some fair amount of complications along the way. Nothing earth shattering, but it's an adventure, and for me, everybody was like, "Well, why did you write a book?" And for me, it was kind of half compassion and half frustration, right? So when and I don't know if you were able to kind of be mobile when you were having your inpatient chemo.
I could walk a little bit.
Yeah.
Around the hospital.
So I would do laps, and it was
Yeah, we would do
That's
that.
laps.
Yeah.
We did lots of
Yeah.
laps.
yeah. So put my headphones on and do laps, and
He had me singing next to him. He didn't need it, or probably needed
Thankfully-
headphones to block me off.
Thankfully,
but
we were together. But wait, I want to ask you.
yeah,
So you had a family at this time. You had kids, right?
yeah, you have.
Yeah,
I
right.
saw you have 3 kids. So how old
Yeah.
were your kids when you were
Yeah.
going through this?
Because that must be difficult.
was my oldest in college. I want to say he had just started college, and then my middle daughter was in high school, I think a junior, and then the
Okay.
one was a freshman or thereabouts. Yeah, so we were, they were serviceable in terms of being young adults that could, if we said go home and make yourself dinner, that was okay, sort of
Right.
thing. But it's, they were in. No, actually, my oldest son was a senior. He was a senior. My daughter was a sophomore, and my youngest was in 8th grade. That was the
Okay.
layout, and they were involved in sports and all this kind of stuff. So, my
Which
wife,
helps.
God bless her, man, she was chasing them around, and luckily I was at Ohio State, the James Cancer Center at Ohio State. My wife actually, probably 3 weeks before I started into treatment, she got a job there through a friend. So she was
Wow.
literally could walk over at lunch, and then 2 of my kids would train down at the pool down there. So it was, of all the places to land, it was really
That
pretty
was
close
meant
to
to be.
everybody. Yeah.
Yeah, that's.
But it's a lot, right? I mean, as you guys know, it's just a lot.
No,
So
it's a lot. I'm sure you had to stop working at least when you were inpatient.
yeah,
And that was a different time. That was before COVID. Like that's the one
Yeah.
like kind of good side about COVID is people are being virtual and working
Yeah.
from home. But
Yeah.
this was pre-COVID, so it
Yeah.
wasn't like you could say, "I'll just log on."
yeah. Well, and I did a fair amount of that. So luckily, I was in a position where it wasn't too terrible to try and do that. But no, you're 100% right. I mean, it's hard, and the thing that looking back on it, and Michael, I don't know if you have the same sense, but it's like I didn't realize how fuzzy my brain was
Like the memories from
until,
back then.
until later.
Yeah,
Right?
yeah. Like I look back in the memories and I'm like, I can't even remember a full day.
Yeah,
Yeah.
yeah,
He's lucky I took a lot of videos so I can remind him. I can be like,
yeah.
look at this video. Do you remember when
And
this
I
happened?
actually started when I got diagnosed. I started a diary on my
Yeah.
computer.
Yeah.
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 So
That's been
are you still
amazing.
going? Did you
Yeah.
stop the
Yeah.
diary? You
Every
are. Okay.
day.
That's great.
It's like a
That's
little
great.
paragraph I write. It's not much, but it's just like
Yeah.
I like to remember and look back sometimes.
Yeah.
Like, oh, this is what happened. I was doing this.
Yeah. Yeah. And
So
I
wait,
did that a little bit when I was in the hospital because you know how it is. Like there's so many there's your kind of immediate family, then there's your kind of close circle of friends, but then there's all these other people, completely well intended, trying to help you somehow, but don't really exactly know what to do. So I just started writing a blog about here's what happened today in the hospital, and tried to make it reasonably funny. So a lot of that's in the book. So
I like that. That's
that's
cool.
literally, I kind of do the same thing.
yeah,
It's spaced out, but I do the same thing just to
yeah,
update people in general because there's a lot of people that
yeah,
care and reach out, but it can also
yes,
be overwhelming.
yes,
I mean, for the patient, the survivor, and the caregiver as well.
right,
I know it's a little bit different with ages with you, but
yeah,
yeah, we have like similar stories in different ways too, because I went through this as a caregiver for my husband. So I can also relate
right.
to your wife who was working and trying to take care of the kids while
Insane.
you were going through everything. I
Yeah,
remember that my kids were a little bit younger, so they weren't quite as independent, but
yeah.
that was a challenge too. It's been a different challenge with Michael, but that was a challenge. But how long? So when you finished radiation,
Yeah.
have you been, I mean, we always say you're always tied to cancer like forever and ever.
Yeah.
It's like part of who you are. But have you been in remission since? And not that, like, remission is such a loaded word anyway. But
Yeah.
have you been without treatment
Yeah.
since?
Oh yeah.
Okay.
Yeah. Yeah. They're like, get out. We're done with you. So it's how the cycle is. Like you go every month, then every 3 months, and every 6 months, and
But
then
we don't know yet.
eventually, well, hopefully, right, you'll get to that angle. But it's and I think after a couple of yearly appointments, they said go away. But it's hard a little bit because there's no obvious symptoms of what I had, right? And I think
Okay.
that's probably my guess is why the diagnosis for Michael took so long as well. It's just it's a little bit of a detective story, and it's almost the last place they look.
Right.
So especially with somebody young and healthy, right? I mean, that's the crazy part. So,
Yeah, we were just everything, like all the chips fell in the right place for us. We
yeah,
had the right doctor who
yeah,
was determined to figure it out with a group of doctors that he brought in to help him. Like we were so lucky in that case.
yeah.
Did,
But
did you go to therapy?
I knew you were going to ask that. I had that question written down too. Did
No,
you?
no, like counseling, mental health counseling or something.
Yeah.
No,
This was your therapy, I'm pretty
no.
sure.
Yeah, I mean, it kind of was, right? But it, and one of the two reasons that I decided to write this book was I was walking around on my floor and it was dead of winter, freezing cold, middle of the night, and I'll never forget. There was this lady in her room and she was just wailing, and and I go to the nurse. I'm like, there's a problem down here. You baby ought to roll down there and see what's going on. And she's like, nope, she's just lost it. And they sent counselors in to help her and whatnot. It was just too much, right? And I totally get that. And you see that, and that's what kind of drove me to write this. It's kind of like an instruction manual, not exactly,
Yeah,
but
it
it's like
is.
if somebody would have just said, look, here's 5 things to work on. The minute they told me I was sick, here's 5 things to work on, right? I would have been 1,000 times better off. I mean, my first day in the hospital, I was this close to a meltdown. And I'm not a meltdown person, let me tell you,
Right.
because I didn't have any kind of roadmap for how to conduct myself. So, yeah,
I feel you on that because I feel like Well, I have another question I want to ask you. How long it took? 'Cause I don't want to forget this, but I do feel you on that. 'Cause I feel like, especially with my husband, I think in the adult world, it's a little bit harder to connect the dots. I think in the pediatric, like, it was pretty immediate that when he was diagnosed,
Yeah.
that literally we had a therapist come in, we had social
Yeah.
workers come in,
Yeah.
we had the BMT specialist come in. Like, we were given a bigger support system, which is ironic because the pediatric facilities actually make less money. They
Yeah, sure.
actually
Yep.
doctors don't make as we know these facts now.
Yeah.
But I do remember with my husband, there was support, but because I did read your book, maybe there was support and I didn't know about it,
Yeah.
but
or
it wasn't
opt in.
presented to
Yeah,
us.
it's opt in, right? Opt
Right.
in when somebody's in big trouble, and I just 100% agree. My advice always is, if you feel like it's too much, then raise your hand, right?
Yes.
Somebody will find you help, right? And if no one is willing to help you, reach out to me. I'm happy to talk to you. I'm no expert, I'm no doctor, but it's just like
No, you're an expert because you've lived it. You are an expert. I mean,
yeah,
you hate to say expert. I literally, I was writing a blog this morning talking about that. Like, we're not experts, but we kind of are,
Yeah.
just because we've been living it for 3 years. And
Yeah.
you're an expert too. How long did it take you between being in remission, or I don't even ending your treatment, I want to say,
Yeah.
and
writing this
deciding
book.
to write this
Yeah.
book.
Oh,
And
okay.
by the way, I'm gonna post this. I'm gonna put it in the notes, but I just want to say it out loud now.
Yeah.
It's called "How to Be a Cancer Patient" by Jeff Boothman, and I think it's wonderful. I love it so much. He sent us a copy, and I love it.
yeah.
But how long did it take you in between your end of treatment and maybe even deciding to write the book, or did you know right away you wanted to?
No, I started to write it pretty early on, but it's interesting because it does a lot of times take perspective to get clarity to be able to explain things to people, right? So I kept coming back to it, right? I would write it and then I would read what that is, and I'm like, well, that's okay, but then I knew there was this kind of bucket of things that I wanted to cover that were important. So long story short, it's probably about 5 years, soup to nuts.
Wow.
Okay.
And it's not a very long book, as you can see.
No, but that's good.
Yeah, I just wanted
Because it's
to-
not intimidating. I was
I wanted to
scared.
get right, yeah.
When you
So-
said you were sending us the book, I was like, "Oh my God, am I gonna have time to read it?" But
Yeah.
no, it's a
Yeah.
great size and it's easy. Also, what I love about it is you can flip through, and you can land on a chapter and read that.
Yeah.
And I really like that about it a lot.
Yeah, yeah. So yeah, I mean, it's and I'm not a writer. Lord knows my 7th grade English teachers probably freaking out right now. What? Right? I was a
They
guy-
are so proud of you, and they are claiming the
maybe.
fame that they were your teacher.
Yeah, maybe, I don't know, but boy, I was not good in English, let me tell you. So I was okay. I mean, I kind of learned to write a little bit better as I grew into adulthood, but it's
Me too.
Yeah, right. I mean, it's and you do it you practice it every day, which I think is great.
Yeah.
Yes.
Writing is one of those things that, like, when you're in high school or middle school, you're not, like, so stoked about it. But as you get older, you're like,
Yeah.
it's pretty cool. Like,
Yeah, it's a chore versus a kind of a relief or a release.
yeah, exactly.
Yeah.
And I know you even say that in here, grab a journal. I've heard that a lot of.
Yeah.
It's great. It is great advice for
Yeah.
any survivor, for any caregiver. Like, it is for anyone going through anything. In fact, it's my daughter, she always tells me when she's going through anxiety, she's like, okay, I'm going to go journal now. And
Right.
I'm like, yeah,
Right.
it's a great tool. And you turned your journaling into
So wait,
a great manual. But
so
yeah.
speaking of tools, like,
Yeah.
I just want to ask this kind of like personal question. What do you like to do, like, for fun? Like, you know what I mean? I love asking people those questions.
Yeah.
Like, what are your hobbies? What is, like, some cool
Because
stuff
what got
about
you
you?
through this? Like, Michael, we talk
Yeah.
about the things that we've done.
Yeah.
To
Because you have to
cope
escape,
and-
not escape, but
Yes, escape.
Yeah.
Yes, escape.
deal.
Well, I mean, a lot of it was centered around my kids, but I like
That's true.
being outside.
Yeah, me too.
I will garden. I will, we're building like walking trails on the property we live on. running around with the dogs.
How big is this property that you're building
not very
walking
big.
trails?
Yeah, it's not very big. It sounds like, oh, we're going to have, no, it's like 7
Bigger than
acres.
ours.
It isn't that long. It isn't that long.
We live in an apartment, so,
A
you know.
2-bedroom apartment.
Yeah. But that to me was the most therapeutic thing, just walking around outside. And
Yeah.
it can be freezing cold, it doesn't matter, right? It's just that whole sense that you're out and the trees are out and maybe the sun's out and maybe it's not, but it's just that kind of relief you get from being in nature. So for me, that was a big deal. So we planted trees, we built a big giant garden, we do all this kind of stuff. And in the winter, I don't know, I'm an amateur woodworker, so not very good at it, but I'm learning.
My husband too. And it's so ironic. Like, that is one of the blessings also at the pediatric hospital where Michael was. Outside, it's beautiful. Like, if they would let him when he was okay and they would let us go downstairs and go outside, it was beautiful. And then there's another hospital where you're treated, it is not nice outside. The adult hospital, like, you would never want to go outside and get fresh air there, which is kind of sad because going outside, nature's so important.
Yes, 100% agree.
So important.
Out of all the people in the world, who has had the biggest impact on you, you would say? If you could choose like one person.
Is there someone in your life, or maybe it could be, this is one of our signature questions. It doesn't have to be someone in your life. It could be someone that doesn't know you, but it could be someone in your life too.
Yeah, wow, that's big.
It's
question.
big.
So I kind of think of it two ways, right? One is kind of in your family circle, right? There's somebody that...
Yeah, of course.
And I think that would probably be my maternal grandmother.
Oh.
And not necessarily by anything. It was just, she was just a great example, right? You know, my mom followed in her footsteps, my sister to some extent, a lot of my cousins. It was just to see her operate was amazing, right? Always nice to people, you know, got herself together when she's going to the grocery store. I mean, like every possible thing, right? She just had herself together. I think that was a great example. I think, you know, on the other side, from kind of an aspirational side, I look at a guy like Ben Franklin.
Okay.
And if you read about all the things he's done, right? He's a lot like me, and I have kind of career ADD, right? Where I've done all these different things going through. He was exactly the same way. I mean, the guy was into everything. And it was, you know, he's over in France and is an ambassador, and he comes back here and he helps, you know.
Leonardo da Vinci, scientist, artist.
Yeah, I mean, it's just crazy. Like if you read something
like wow,
you know, a true person of curiosity. I thought that was great. So
I love that you said that, curiosity, like a person of curiosity. I think that is so important. So, you know, obviously we'd been through cancer with my husband, so when Michael went through it, we were kind of prepared. Had you had anyone close to you when my husband went through it? I didn't know anything. I was like, I don't know anything. It was my first experience. With Michael, it was the second, and I felt so much clearer.
Yeah.
Had you ever been through cancer with any of your family or anyone close to you?
Yeah, with my father, but it was lickety split. I mean, it was.
Right.
He had he had a tumor on his tongue.
Oh my gosh.
Which is like a crazy place to have a tumor, right? And all the doctors are like, oh, I don't know what it is. So they finally biopsy it, and they're just like, oh yeah, you may have a problem. And then they do a scan, and they found it was pretty pervasive. So. You know, it was a quick trip from there, I think, for him. But, you know, I think it's different. And actually, I think you get a sense of this. It's totally different as the caregiver versus the patient, right? And so for me, being caregiver, I wasn't tuned into how do I help, you know, for instance, how do I advocate for him? How do I go and gather more information to go help relieve stress, things like that. It wasn't even a thought in my mind. I was like, okay, well, how do I get him to and from appointments? How do I make sure he's comfortable? You know, how do I give him medical options if there are some available? So, you know, if I would have known then what I know now, I probably would have been able to, you know, maybe help differently. I don't know that it would have changed the outcome, but
I know.
Yeah.
That's how we feel too.
Of course. Yeah. I feel like I learned so much.
Yeah.
on the first time with my husband and then with Michael, and there's so many things I think I would have advocated differently, but you can't look at it that way. We just have to look at it like
Yeah.
we had to go through that process to get
Yeah.
to where we are now.
Yeah.
So if we hadn't gone through that, we wouldn't be where we are now. So it's hard to look back and have regrets,
Yeah.
you know.
Yeah.
But of course,
Well,
I wish there were ways to know what I know now then, but we
Yeah.
had to go through it. And that's
Well,
it's hard.
One of the things, though, it's like if you think of it, right, you're trained in large part not to challenge the medical system, right? And while I would never go tell a doctor that they're wrong about whatever diagnosis, right? All the process steps that happen when you're a patient, it's certainly fair game to ask every single question you have about those.
Yeah, we do.
I'm telling you, I wrote that this morning. We are on the same vibe, dude.
Yeah, right, of course.
There is no question that is off limits, and you should never feel like
100%.
like doctors. Sometimes we think that they are God and they have the control, and they are. They have a lot of knowledge, but every body reacts differently, and you have the right. I agree with you so strongly.
Yeah. And that to me, I think, and for me, I never had any problem with it. I told a story after I got done with my chemo. I was getting ready to get handed off to a radiation doctor, and my hematology doctor was like, "Oh, well, you could go see Dr. Smith or Dr. Jones or Dr. whoever." And my wife was with me, and I'm like, "Well, I don't really care. Just tell whichever one is the smartest. That's the one that I want."
Right.
My wife, oh my God, you thought I just asked for something. She was like, "Oh, you can't ask that." I'm like, "Well, that is what I want, though. I really do want the smartest person on my team. If they're nice, it's a benefit, but I want somebody that's going to help me get better."
Right.
So, yeah,
We want the one that's the smartest, the nicest, the funniest, the kindest, the most
You're
compassionate.
asking for the world, Mom.
I
But
want
they
the
don't have that
world.
one, though. Yeah, they don't have one of those, right? So
Yes,
I'll
they
just pick the smart one.
do. Don't you think we've had many of
We've
them?
had some of those.
We've had some,
Yeah.
literally yesterday,
We've
the
been really lucky.
hepatologist. Nice, smart,
Yeah.
and spent over an hour talking to us.
Yeah.
It was amazing.
Yeah.
So
Yeah.
you can ask for the world. You might not
Yeah.
get every single one, but
Hey, look, the lady I had, she was great. I mean, fabulous, super. I mean, really smart, really bright. When there's some people you talk to that pretend like they're smart, and there's other people that really don't care if they, you think that they're smart. She was in that second category. Just great, and it does matter, I think, especially with all the fuzzy stuff that happens during cancer treatment, because there's a lot of gray areas. It's not like they get a report and say, "Oh, well, here's exactly what you have, and this is exactly what you do." It's like when you have a complication, you need somebody to say, yeah, it's probably not a big deal. It doesn't mean we're not going to watch it, but somebody that's okay to say that with confidence is totally different than, well, I don't know. We're going to have to spend a lot of time, right? They're two different approaches, right? They're both going to do pretty much exactly the same thing, but the stress level that you feel from the person that says, "Yeah, I don't think it's a problem, but we'll watch it," versus the person that says, "Well, I don't really know what it is." Those are two different things in terms of how much stress you feel as a patient, right? So I'll take the first person in that case.
I think so too, but I think we're also lucky in another sense that Michael has had like a team, and they have communicated really, really well. And like they still to this day, now he used to be at the top of the list of priority when he was, about to, didn't know what was going to happen the next day. He's lower down on the list now, but he's still part of the conversation. And we know that they discuss him as a team. And then at the other hospital, at the adult hospital, they communicate. So I feel like there's part of me that's in there because I will email both together. I will text both together. But we've had this, and I think that has been huge because when one says, "I'm not sure," another one says, "Well, I've had experience with this."
Yeah.
And they sometimes, not that they fight, but sometimes they do have conflicting thoughts. And then we kind of wait and see which one works.
But my guess is it's in large part because you guys, as a cohesive team, are, advocating. Hey, what about this? What about this? You should talk to this doctor because he's seeing this. I mean, all that kind of stuff. And not everybody does that, right? Because you got to be a little bit insistent. You got to be a little bit persistent. You got to be, I mean, all these kinds of things that a lot of times, and especially dealing with doctors, people aren't comfortable with.
Yeah.
And
That's why your book is so good.
Yeah.
But that's why this book that you wrote is amazing, because I think it's going to help people to navigate the things that either we don't think of, or that we're too scared to ask, or we're not sure if we have the right to ask. I think it's really, really important.
Yeah. I mean, definitely we need people to be writing books like this, and the fact that you did it, it's great.
I love it. I think every cancer patient caregiver needs to pick it up.
Yeah.
Extremely helpful, and don't mean to change the topic too much, but I want to ask you.
We want to ask fun questions. Can we go for the fun now?
Because we've been pretty serious. So, what's your favorite movie?
Oh,
that was a hard one.
That is so hard. It just depends on the day. I watched Godfather yesterday, but that has
good movie and great.
So well done. So well done.
So good.
I've never watched it.
Oh my god! I need to change that.
I don't know. I mean, when you're sick, that's probably not the best movie to watch. But,
no, it's not.
Like The Rookie with Dennis Quaid is a
oh my god, that's a good movie.
Oh, it's such a good movie, right? So
I haven't seen that in a long time.
Yeah, those are kind of two of my favorite. You know, other than like Caddyshack and Raiders of the Lost Ark, all these kind of pedestrian ones. But
love Raiders of the Lost Ark.
Yeah.
What about? Do you have a favorite book? You just wrote one.
No, I read a book a long time ago in grad school called The Fifth Discipline.
Okay.
Which was really for me a huge kind of brain expander. But it's written by a guy at Harvard Business School, and it describes how systems. If you define how a system works, then you're better to understand and navigate in it. So one of the examples they go through, it's really amazing, right? So they have this thing called the beer game, and he sets the system up in a way where there's three groups of people. There's the store owners, there's the beer distributor, and then the beer company with the brewery.
And then there's the beer drinkers, and that's at college.
Right, yeah, right.
They're the ones that are at Harvard Business School.
Yeah. Long story short, he sets this game up in a way where each of those three groups make perfectly logical, consistent decisions, but the whole system breaks down. And the whole point was, and by system breaking down basically means at the end of the game, the brewing company had built, 2 new breweries that were churning out all sorts of beer that nobody wanted. Right. And to me, it was a huge thing, a huge learning that, the structure of the system could be the problem. Right. And that's one of the things that when I look at how the hospital systems are constructed and how they deal with cancer patients, mental health, right? Not their diagnosis, not getting them better, but their mental health. That to me is the way I can make sense of it, because there's no department that's in charge of reducing patient stress. They don't get paid for it. So
well, I don't know. We had a palliative team, and when people hear the word palliative care, they think hospice. They think end of life. Yeah. But in fact, they're trying to change that in the cancer world.
It was at least at the Children's Hospital.
No, but even at Sylvester, because I was just at this symposium, and they were talking about how palliative care, they're really trying to redefine how people think of palliative. And I'm not saying that everyone has offered this and knows about it, but they really are, like, their whole point was to reduce the stress of what Michael was going through. Yeah. And it was not introduced to us on day one. It was not introduced when he was diagnosed. It was actually introduced, I would say, about 1.5 years later, when you were going through the third, fourth time that he almost passed away, and they came in. Yeah. And when they came in, I was terrified. I was like, palliative, this is hospice. And they were like, no. Palliative is to make him more comfortable. But it was mental, it was stress, it was physical pain as well. It was pain as well. They would
talk to pain doctors, they would talk to my doctors, they would help him a lot. They were like, if there's anything you need that we can help you with, make you more comfortable. It was great. But it was at a time where I was so sick I didn't really want them there in a way.
But they were there anyway.
Yeah.
Right.
Well, because I signed off on it. But
yeah.
But they are trying to change that narrative. So
I hope
it's happening slowly.
Yeah.
But I see it in like little tiny bite-sized pieces that it
Yeah.
is trying, but I agree it's not like that for everyone. And also things are offered, and it doesn't mean that you opt in, that you know about them. I know at Sylvester there's so
Yeah.
many things offered to patients, but we
100%.
we don't know about them. We're
Yeah.
getting to know about them, but it takes
Yeah.
2 years,
Yeah.
and not everyone has 2 years. And
Yeah.
but I agree with you, the mental health.
But if you look at it, right, at least from what I see locally, right, the focus is explaining to everyone that their cancer is unique, right? Yours is one of a kind because you're a different person, and everybody's diagnosis is unique. The crazy thing about it is, though, everybody from a mental health challenge and experience, that every cancer patient's experience rhymes, right? You're told you're sick, you freak out, you need to learn how to navigate the medical system, you need to learn how to navigate your treatment. There's going to be problems. How do you handle them? I mean, all those challenges are pretty much the same for every single patient.
Yeah.
Right? And it wouldn't be that hard, and this is the first attempt at that, to just say, look, here's some guidelines. Start here, right?
Yeah.
And if you really don't think you can deal with it, then raise your hand and get more help.
Yeah. No, we agree. I mean, Michael has a cancer support group. I have one for caregivers, and it's not like you could only join if you have hepatosplenic T-cell lymphoma.
No.
Right, yeah.
Anyone with cancer
There would be
has been
one.
through cancer can join because it's relatable. Any caregiver. Because
Right.
I agree with you. Oh my
Right.
gosh, we totally went off of our fun. It was still fun.
Okay, yeah,
but I
sorry,
think
yeah.
the beer experiment, like that went from the book to the beer. That all goes back
Yeah.
to communication too, and connection, and
Yeah.
that's one thing. Okay.
So if you have
another
a-
fun question.
Yeah, okay.
What's sort of fun? What's
Sort of
your
fun. It's
greatest
fun.
message and the last message you want to leave to people?
Oh.
That wasn't what I thought you were going to ask. I thought
But I
you were
wanted
going
to ask it
the
because
other one.
we kind of got deep there, so I was like, we're on the
All right,
deep
let's
track
stay deep.
already,
Let's
so let's
stay
just
deep.
stay there.
Yeah.
All right.
My message is, you are the expert of you, and you need to go work on your behalf to be the best cancer patient you can possibly be, and ask whatever question you think you need answered, whether it's comfortable or not. And if you're not comfortable asking those questions to your medical team, then find somebody who is. But don't leave the moment of when you're being diagnosed without knowing who's going to go and be that advocate for you, either yourself or someone else. Absolutely have to do that.
Thank you.
I love that message, and I agree with you. And also, I think everyone needs an advocate or someone with them, because even if you're brilliant, smart, when there's moments that you're fuzzy,
Yeah.
there's moments that there's like too much going on.
Yeah.
And there's things he catches that I miss, and there's things I catch. It's like that in
Right.
life.
Yeah.
Like
Right.
it's good to have a partner. Because always two minds are better than one,
Right.
even if they both have chemo brain. I have second hand. He has first hand.
Yeah.
I thought you were gonna ask that question.
The superpower that you wish you
Yeah.
had.
Oh, that is really hard questions. Very
No,
good.
that's a good
Nice
one.
job
That's
with
a
these,
good
right?
one.
So,
These are fun.
That's a fun one.
if I could eliminate suffering for everyone. and not
That's the
just-
magic wand one. Wait, that's if you could
It
wave the
is.
magic
I mean,
wand.
it's.
Wait, 2 in 1 question.
2 in 1.
Yeah.
Okay.
Yeah. Yeah, I mean, it's just, you see some of this, and, I try to help. You guys are doing a great job, I think, of trying to help and build relatable content for people. So, I mean, that's for me. And this, I think, is fixable to some extent, or to a large extent. The stress of it is fixable.
Yes.
I can't fix everybody's cancer, but I hopefully can help fix their stress just a little bit.
Yeah. Just a little bit of help
Yeah.
would be, even just a little bit. I agree. That's what we always say. If one person listens and gets something out
Yes,
of it, we'll
100%.
take it. We'll take it. I know that.
Yeah.
Do I do our final question?
All right, this is the final question. If can I ask?
Yes, you go ahead.
Okay. So, and the answers tend to be so similar, but we want to hear yours.
Yeah.
If you knew tomorrow, like today was your last day, you were going to pass away tomorrow,
Yeah.
what would you do today?
Hang out with my family and have family feasts and walk around in nature with my dogs with them in tow.
I love that. Like,
I love it.
We started asking this question maybe 10 podcasts ago.
Yeah.
I think
Everyone does family.
every single person has said be with family, and
Yeah,
that
that's
I cannot
good.
tell you
That's
how
good.
happy that makes me.
Yeah.
It just I think that's beautiful. Thank you so much. I mean, you're amazing. This book,
Book is awesome.
I love it.
Thank
We're
you.
going to share it. How to be a cancer patient, Jeff Boothman. Jeff, how can I know that you can find it? Like, honestly, when I went to Google you at first,
Yeah.
before your website even came up, Amazon came up with the book, and
Oh,
I was
good.
like, woohoo! And then your website was right under, but I was like, okay, Amazon. So you
Yeah.
can find the book on Amazon. You can find it everywhere.
Yep.
And it's jeffboothman.com is
That's
your
it.
website.
Yep, that's it. So anyone, anywhere that needs any kind of help where I might be able to provide it, I'm happy to take the phone call or take the email, just like you guys, right? So
Yes.
kudos to what you're doing. I certainly appreciate the opportunity, but also the opportunity to congratulate you in person about what you're doing here. It's huge.
Thank you.
How are you feeling? How do you feel?
Oh, I feel great. Yeah.
You look great. I mean, if
Really?
people are watching on YouTube, you look great. You look healthy.
Yeah.
You're glowing.
Yeah, well, that's probably the lighting. I'm not very good at all the podcasting stuff, but so I don't know if I look orange or blue or purple or whatever. So
You look amazing.
yeah,
You look
okay,
great.
well, thanks.
Oh.
But yeah,
Thank you.
Thank you
how
so
do I
much for
help-
being on
How
the
do I
Thank
help you guys in your mission? Is there anything I can do on my side?
Keep doing what you're doing.
Yeah, keep
Yeah.
doing what you're doing.
We're like on the same page. We're the same book. We agree with you. Same philosophies.
Yes.
And so many things you said today. I was like, oh my God, it's exactly.
Yeah.
We're on the same page.
That's
And
great.
this is an official goodbye from your host, Michael Kramer, and
The official mom, Ashley Kramer, and thank you so much, Jeff.
thank you.
Amazing to have you.
Yeah, thanks, guys. Michael, all the
Thanks for
best.
listening.
Thank you.
Yeah.
Mwah.